Hi everyone, welcome back. My name's Dr. Amna Husain, board certified pediatrician and board certified lactation consultant. And today we're going to do a special episode again, a pregnancy Q&A with me, the pediatrician. So you guys sent in a ton of questions. I was able to go through most of them, get rid of any of the repeats, and organize most of them so they made sense. So of course, tons of questions on the gender. Yes, we actually do know the gender. I was able to get my anatomy scan a few weeks ago. During COVID, my husband really hasn't been able to come to any of the appointments, but he's been able to come to the 12-week ultrasound where we check for nuchal translucency in baby, and he was able to come to the anatomy scan ultrasound. So lots of really good pictures. I had a full bladder, so that helped to have some really good pictures, but it did make for a very uncomfortable scan for me. We were able to find out the sex of the baby, and to be honest, I think both of us were on the same page that we wanted to know. I personally am just a little too detail focused to not know. I think it's really exciting for people who do wait until delivery day to find out, but neither my husband or I have ever been those kind of people who could definitely wait if we could find out early. I know with Asia, when I found out, I had to go back multiple times later for growth scans because I had gestational diabetes and gestational hypothyroidism. And each time I was like, are you sure it's a girl? Are you sure it's a girl? So this one, we had some really clear pictures, and yes, we do know the gender of the baby. Stay tuned, we will be sharing soon. So cravings, maybe I'm like that very rare random person in pregnancy that I don't really have a ton of cravings. I think even with Asia, I wanted more savory foods, which for me is a little outside the norm because I do have a bit of a sweet tooth. I love fruit, I love chocolate, I love ice cream. And this time I was looking more at cheese and looking forward to the savory parts of meals and wanting maybe eggs for breakfast rather than, cereal, waffles, your typical carbs. It was probably better for me because I was eating more protein. In general, I'm more of a salad person, and I just didn't necessarily want salads, and I wanted a sandwich maybe. And again, I try to think that it's, maybe it's more calories. I was trying to eat better foods for me, things that were calorically dense, but with good nutrients. So if I was eating a sandwich, I would make sure I picked whole wheat bread. I didn't layer on fatty condiments or anything like that. But I think maybe just more savory foods in general. Oh my God. Yes. And I'm only at the halfway point. Yes, this pregnancy is much harder. So to give you guys some context, I was pregnant with Asia 4 years ago. So I was a resident at the time. So after 4 years of medical school, we go through residency, and you can pick residency in whatever field you want to go into. So obviously I picked pediatrics. I'm a pediatrician, and residency is a tough time in medical training. You have long hours. You can be doing long calls in the hospital. You may or may not get sleep during your calls. You may be on your feet very frequently during the day. You may not get a chance to eat regular meals. And that's pretty much how my pregnancy experience went. Sure, you'll have rotations where you are able to maybe be in the clinic setting and things are a little bit more controlled and you're able to eat regular meals or sit down a little bit more frequently. But definitely there were a lot of calls I did while pregnant with Asia in the ICU and not getting a wink of sleep. So it was a bit of a stressful pregnancy in terms of also being a little hard on my body. I would say this pregnancy feels a little harder on my body. My husband likes to poke fun at me and say that I'm older, and I don't know if he has an early death wish or something. But definitely I feel like, I always talk about this, but I feel like the mechanics of my body, the musculoskeletal component of it, I'm just having so many more aches and pains. And namely, it's in my low back area. And I'm a pretty regular exerciser. And I think we do have a question later on exercise and how I changed it in pregnancy. But I feel myself having aches and pains in my low back, or in my legs, things like that, getting tired very quickly as being a parent to a very energetic toddler as well. during this pregnancy. And I think back to when I was pregnant with my daughter, Asia, and when I was a resident, and I just feel like I used to only feel that way after a very busy call. And then maybe as I got further along in my third trimester. So I do definitely feel like I'm feeling those symptoms much earlier now, and I'm a little bit more sensitive personally, I think, this time around. So we actually told our daughter kind of early, and we actually kind of went back and forth about it. So I found out very early, kind of, I think even before the 4 or 5 week mark, that I was expecting, and we kind of held off on telling her until after, the initial ultrasound that confirmed the pregnancy, being intrauterine, a heartbeat, etc. So the initial, 6-week ultrasound, we sort of held off on telling her until then. And of course we had a picture to bring home and show her, and she was incredibly excited about the picture. For us, we did tell her a little early, and I am the parent who's typically, taking care of her in the afternoons, because if Zane's working a little late, so that means like rambunctious diaper changes, running after her, etc. You guys who are parents of toddlers know they love to kick, even when they're playing around. So we were trying to just sort of instill in her a little early on, like, not to like kick mommy in the stomach area, or if I was feeling a little tired, we could, kind of start planting the seed in her mind about it a little bit. We didn't really have big hopes that she was going to pick up on it very quickly. She was 2 going on 3 at the time, and now she's 3. And I think it is slowly sinking in. Again, we decided to tell her a little earlier on just because we figured that she's young. If God forbid something were to happen, we would, explain to her in the most developmentally appropriate way what happened. But overall, if things are progressing in a good direction, we wanted her to, start to become accustomed and used to the idea of having a baby brother or baby sister in the house, and kind of get her excited about that. So being a pediatrician, I actually started prepping her a little early, and I feel like it was important because some children do have some developmental and behavioral regressions, typically behavioral regressions, when a sibling enters the situation. So she's been pretty much an only child for 3 years, right? And she's getting a lot of attention, and that attention is now going to be, somewhat divided. And it's really important for her to know that love's not being taken away from her. It's just more love is being created for another person. And so trying to get her used to it early on. And the important thing with siblings or children who are going to become siblings is to try to space apart big changes in their life as much as you can. So for example, we plan to transition her out of a crib, and we wanted to do that a little in advance so that she wouldn't regress or, have backlash about another baby having her crib. And we got her really excited about her big girl bed. We are currently daytime potty trained, and I just can't get on board yet with nighttime potty training. She's not there. I'm not there. I'm comfortable with her, continuing to wear diapers at night. This is a good decision for me at the moment for how much I have on my plate. And I realized that if I sort of pushed myself maybe and pushed her to do nighttime potty training, it could be very well the first thing to regress once the new baby comes into the situation. So, we try to sort of pick and choose our battles. Other things, so we do plan to enroll her in school in the summer. I think the vaccine will be more prevalent and available to the general population by that time. That will be around our due date as well. But it's obviously going to be a change that's going to happen close to the baby. So again, it's something that we've been trying to work on and get her excited about. She already is really excited about it. So for us, it was kind of slowly introducing changes so that she wouldn't feel like everything happened at once and that things were being taken away, and that familiar sense that she was sort of used to, her room, her routine, mom and dad, always being around, that we didn't want her to feel neglected or feel that something was being taken away from her. So we've been actually trying to do this slowly, every few weeks to every few months, add in a different change, and hopefully that will help with some behavioral regressions. Now, I'm not naive. I know that. I look at her and I know that she's definitely going to have some jealousy, and there's going to be a little bit of a learning curve for everybody in the family. Maybe not the newborn, but definitely the parents and her for adjusting to another person in the house and another, child in the house. But if we can do anything to sort of, ease out the transition and make it a little simpler, I'd be happy to. One thing I will also say and recommend is there's a lot of books that sort of emphasize, becoming a big brother or becoming a big sister. And we did buy a few books for her for becoming a big sister and have been reading them to her. So she's been getting a little bit more excited about it. And I can see that, she actually sort of talks about the books when we're just having conversation and talks about baby brother, baby sister in conversation. So I can see that she's getting excited about it too. This is a great question. I always love to exercise. I've been really regular about fitness and making sure I get my workouts in probably since college. And even when I was a resident, I tried to take time to work out at least, 4 to 5 days a week. At that time, I used to do more HIIT training because I was a little short on time, and I kind of got the most bang for my buck. When I got pregnant with Asia, I decided I didn't really feel comfortable doing HIIT training. Now, that being said, I am not a physical trainer. I am not certified to give advice to prenatal women during their pregnancy on exercise. This is just what I felt comfortable doing. There are definitely trainers out there who say that you can still do HIIT training in pregnancy. I'm not here to give you advice on that. I'm just here to tell you sort of what modifications I made. So I've always kind of really been into weightlifting as well. After having Asia, I've really enjoyed weightlifting and getting a chance to really breathe through exercises, find myself getting stronger. And then, I didn't really change anything when we were thinking of having the baby, but after I got pregnant, I just tried to be a little bit more cognizant of listening to my body. And I know that sounds really cliche, but I could be somebody that would push myself through a workout or push myself through a set or push myself to lift heavier. And this time I really didn't do that, So if once I was expecting, if I started feeling short of breath, I would take a minute and catch my breath. I would not push myself to lift heavier. For me, it was more about really maintaining fitness and doing things that made me feel good. So as I've already mentioned, in this pregnancy, I've a lot more aches and pains, and exercise is one of those things that I can do to help kind of keep those aches and pains at bay. I did do some modifications as well. So maybe if instead of lifting weights, this time I wanted to do more bands, I tried to do more band work, added in planks. I did still keep doing some cardio movements, kettlebell swings, trying to still incorporate weightlifting, deadlifts, sumo squats, all of those good things that I already was doing that feel good to continue doing during pregnancy. Something that's worked well for me is also, thinking of the talk test. So if I'm able to really keep up conversation while exercising, I'm realizing I'm not getting too short of breath. And then I know that I feel comfortable where I am. So that's kind of what's worked for me. Again, I'm not a certified prenatal physical trainer. I also did start seeing a PT because I did have some aches and pains, and I've been taking some cues from her in terms of, okay, I really need to stretch in the mornings before I work out, or I really need to foam roll, and that's not something I really feel comfortable doing now while I'm pregnant. How are ways that I can continue to sort of incorporate dynamic stretching to warm up before my exercise, or things that I can do so I stretch at the end of my workout, but with how relaxed your ligaments are in pregnancy, not overstretch. That makes sense. So I've definitely been trying to listen to my body, change things up a little bit, not do as long workouts personally, just what feels good to me right now, and then use the modifications that work for me in pregnancy. So definitely, I think this pregnancy, I have tried to think about what I can control and what I can't really control and try to go with the flow, focus less on any mom guilt. So to explain, when I was pregnant with Asia, it was after a miscarriage, so I was super anxious about a lot of things. And sort of many times I would get some conflicting news or maybe even bad news when I went to go see the OB if I had gestational hypothyroidism or gestational diabetes, or they were concerned about the baby's growth, multiple things. And so I think I would sometimes internalize that and then feel like something was my fault. I've already mentioned I was a resident, so, gosh, I'm not eating enough, or maybe I should have been doing more. Why did I get diabetes? What did I do wrong? And this pregnancy, well, right out the door, I got COVID, and there's just things that you can't control. I definitely didn't go out there and try to ask for contracting SARS-CoV-2 and then, getting COVID. And so I tried to really think about what I can control and what I can't. So I can't really control the fact that this happened. I can't control the fact that I could try to get more sleep. I can't control the fact that I will try to be better about how my body is handling the pregnancy. So if I'm having back pain, try to seek advice and help from a PT about it, rather than, trying to blame myself or push through the pain or anything like that. So I think it's kind of been, for me, just thinking about what I can handle, what I can take care of versus what I really can't change. And then definitely trying not to fall into the mom guilt. As I mentioned, you feel horrible because you contracted COVID-19 in pregnancy, but nobody asked for this. It's not my fault. It's not the baby's fault. And so trying to be on top of that mom guilt is something that I think this time around I'm really trying to do. Favorite thing to relax, unwind is, it's gonna sound super silly, but it's actually my best friend, as I mentioned, with these aches and pains in my back, has been the heating pad. So my Amazon purchased heating pad has been something that I just love to sit with. And if I'm gonna sit there and watch the news at night, or sit there and watch TV, or even just sit in bed, that thing comes with me. It's probably not the most, glamorous thing, but it's kind of working for me. It's kind of all I can do at this point for any of the aches and pains. Tylenol doesn't really help me that much. So the heating pad and I are really good friends right now. So prenatal plan, I'm guessing this means my birth plan. And I try to think of this, and I actually feel like many other OBs who are on social media feel and state similar items, but I feel I like to use the term birth preferences rather than birth plan, because birth is a completely unplanned thing sometimes. Sometimes babies come early. Sometimes babies don't do well with vaginal deliveries and you need an emergency section. Sometimes things happen and you can plan and plan and plan, and unfortunately that plan just doesn't fit with the circumstances. So I like to use the term preferences. We did go through a class, a labor and delivery class, the first time around with Asia, and I remember that the instructor had a bunch of cards. She had like vaginal, C-section, epidural, I think spinal, or like epidural, non-epidural, boy, girl, like a ton of different things. And she said, like, pick your ideal one. And then she kind of went, and so here I go, I'm picking my ideal one, and I have them all sort of lined up. And then she kind of went through and she was, playing devil's advocate and said, well, what happens if you can't have this vaginal delivery and it's not safe for the baby? And for me, it was a no-brainer. I said, well, then I'll just do what the medical team advises, what's safest for me and the baby. I'll have a C-section. And that's kind of the same way I feel. She asked me, what if you can't have an epidural? And I said, well, then I'll do without it. It's you gotta just kind of roll with what you have, because birth can be unpredictable. And that's exactly how I feel with this pregnancy. So I don't really have a plan, and I am having a baby in a pandemic. So who's to say, what's gonna be happening around that time and what rules hospitals have. So I am staying open-minded and going to kind of go into things open-minded, have an idea of me just wanting the safest delivery for myself and my baby, but definitely taking my medical team's recommendations to heart and just trying to make the best decisions. I don't really have a thorough plan thought out. Which brings me to a doula. So for those of you who don't know, a doula is actually a trained professional who provides either physical or emotional and or educational support to mom, either during the labor or the immediate postpartum period. To be clear, a doula is not a physician, they're not a midwife, they're not a nurse, they don't provide medical care. So physicians, nurses, and midwives all play an important role in taking care of the medical aspect and the medical care of both the baby and mom. And doulas, as trained birth coaches, can sort of complement this model by providing non-medical care. And you can have, postpartum doulas, you can have labor doulas. So labor doulas are the most common, the most popular, and then you can have antepartum doulas, so doulas who you have just during the pregnancy. I personally am not using a doula for my pregnancy. I didn't for my last pregnancy either. I work very closely with many doulas. In fact, many of the antepartum, the labor doulas, the postpartum doulas, they sometimes will recommend me because many doulas, they do in-home coaching or in-home education for parents. They provide more of almost a concierge service to expecting mothers. And then the flip side of it, I am a concierge pediatrician. So the two services complement each other very nicely. So as I've mentioned, I work very closely with doulas, and sometimes they're some of my best referral sources. Personally, I'm not using a doula for myself during this pregnancy. No means is a doula necessary, but there are tons of advantages. So, birth can be a very physically and emotionally challenging time. For even pregnancy can be physically and emotionally challenging. So to have somebody there who is an advocate for you is incredible, especially if perhaps you have a significant other who may not be involved or who may not be able to be there for you as frequently. You have somebody who has a little bit of, knowledge about the whole birth process and is able to sort of guide you and at least be an advocate for you. Now, again, it's very important for me to emphasize that they do not provide medical care. So your medical team of physicians or nurses or midwives, that the doula really can't replace those are very important medical health professionals. The other thing to consider is the cost. So doulas are typically not covered by insurance. Their services can range from a couple of $100 up to $1,000 depending on their experience and what services they provide. It's definitely a strenuous field. I know many doulas who have done amazing work and then they are very frequently burnt out because it is hard to be on call for these families because birth is unpredictable and it can happen at any time of day and at any time of week even. So I think that doulas can be really helpful for people who are considering them. So I surprised my family. This is kind of like a little bit of a bummer, but I actually wanted to tell them in person, but COVID kind of has prevented us from being able to meet with each other in person. So it was over the phone, and I kind of had to tell them when I was COVID positive because I didn't know what was going to happen, of course, and so I wanted to be prepared with, my people, my family, my support system, that if something were to happen in this pregnancy, I wanted them to know that I was expecting. I am COVID positive. This is a really stressful situation. They're my family. I wanted them to know. My in-laws, similarly, I wanted to tell them, once we found out, of course, with being COVID positive, we wanted to just go ahead and break the news to them. Now, sort of our extended family, we held off on telling them just until we knew a little bit more about the pregnancy and we were outside of the first trimester. And, my sister is expecting and my sister-in-law is also expecting. So we have a few babies due around the same time within a few months. And so it's been really exciting actually for us to kind of like share and talk about, the big upcoming things in the future for us. So prenatal vitamins are a multivitamin that contain a variety of vitamins and minerals that sort of help nourish a pregnant woman's body and support her body while she is also, growing this baby. So there's a lot of different components of the multivitamin that are really important. Typically, it's recommended that, if you're planning to get pregnant, that you usually start taking that multivitamin maybe 1 to 2 months before you actually, might get pregnant. But of course, if you weren't taking the multivitamin, they just recommend that you start that prenatal multivitamin as soon as you find out that you are pregnant. Things that sort of set prenatal vitamins apart from other multivitamins, and typically it's the higher doses of folic acid and iron. That's very important for not just the pregnant woman, but the growing baby. So there's other important aspects too that are included in the prenatal vitamins. So calcium, vitamin A, B vitamins, vitamin C, vitamin D, and also omega-3s. So typically the one you might see listed on your prenatal vitamin is something called DHA. So omega-3 fatty acids like DHA and EPA, they actually help to support brain growth and development as well. So they're really important. In particular, I'll show you the one I use. So I actually use Nature Made's prenatal multivitamin. So it talks about actually how much DHA is in it. Zoom in a little bit for you guys so you can see. It's what works for me. I'll be very honest and say that I don't like the taste of prenatal vitamins. There's some that you can kind of work your way around that don't taste as bad, but with my first pregnancy, I actually used gummy prenatal multivitamins, but I ended up developing gestational diabetes, and I found out that I took my sugar once, right, a little bit after I ate a prenatal vitamin, and they actually had a decent amount of glucose in it. So I switched to taking non-gummies for that reason. And then just sort of with this pregnancy, I've gotten into the habit of not really even starting the gummy prenatal vitamins. Say the gummies can sometimes help with the nausea that women experience with taking prenatal vitamins. Other things that might help is definitely taking the prenatal vitamin with food, and some women find it more helpful to take it at night as well. Other things that you might expect with taking a prenatal vitamin is constipation, and you can thank iron for that. Just something that you can expect, and you can absolutely talk to your doctor about, your OBGYN about. And then some women might also see a change in the color of their urine, and that happens with really ingestion of B vitamins typically. Usually this is totally harmless, but if you have any questions, of course, you can always talk to your doctor. Okay, so I am not your registered dietitian for pregnancy. I am not even your OBGYN expert, but I can tell you that the myth of eating for two is a myth. So typically women should be eating about 300 extra calories a day, and those might go up a few hundred calories as the pregnancy progresses, but you definitely don't need to be eating like for two adult humans. That can also lead to other problems down the road. Typically, you should just try to eat a good, well-balanced diet. I'll just tell you what I did. I didn't make any big changes in my diet. This is just typically what we eat. So we had fish in rotation. We used whole wheat carbohydrates, so brown rice, whole wheat pasta, quinoa, normal things that we already used to cook. Milk, so 2% milk. I didn't necessarily switch to organic fruits or a specific organic brand or organic fruits and vegetables. I definitely just always try to eat a good diet that has some balance of fruits and vegetables during the day, and that's exactly what I tried to keep doing during this pregnancy. I think maybe I tried to be more mindful of is my protein intake. So obviously a pregnant woman, it's important to keep up your protein intake, not just for the growing baby, but it's also just a good part of your diet, and you will feel fuller longer with protein rather than simple carbohydrates. So as a daughter of a nephrologist, I never really grew up eating a ton of protein at meals. So it was just something I had to be maybe a little bit more conscious of, that I usually typically eat less protein than the average adult. And so maybe I should just increase that a little bit. Now I still kept it lean sources, but it was just something I tried to be more mindful of personally. I'm a pediatrician, so I have to relate this back to the babies, and I want you guys to know that sometimes eating too much or eating too much of the bad stuff in pregnancy can lead to complications. You may have already known of gestational diabetes, but it can also lead to, even if you don't have diabetes, bigger babies, and bigger babies aren't necessarily cuter, guys. They also come with other complications. So of course they can have glucose abnormalities when they're born. They can also have abnormalities on their CBC and their red blood cell count when they're born. And then, of course, there's birth complications with birthing a larger baby. So just things to think about. So in general, I tried to eat well, but I didn't deprive myself. So I never let myself skip meals, but I would try to be more mindful of what I was eating. And rather than necessarily eat, let's say, a balanced diet at every single meal, I would try to just kind of look at the day and say, okay, did I eat pretty well during the day? And that's just typically sort of how I eat though. Nothing big changed really in the pregnancy. So I don't know, again, I think even just like with the cravings, I'm not somebody who gets a ton of morning sickness. I think in pregnancy with Asia, I had a really overactive gag reflex, which is not unheard of at all. Like I would, gag myself while brushing my teeth and maybe throw up a little bit, but it wasn't something like clockwork, like all the time I would be throwing up or after meals, or I would have unending amounts of nausea. That wasn't really something I experienced with my first pregnancy, and I'm very lucky. And now with this second pregnancy as well, I haven't really had too much morning sickness. I did, however, in the first trimester when I had COVID, experience a lot of postnasal drip. And with that postnasal drip, I do feel like I had a little bit of the same gag reflex and a little bit more nausea, but nothing that was actually like tons of vomiting. So just probably a little bit more intense nausea in the first trimester, but not as much vomiting. Again, super lucky. I count myself as lucky for not really having any of those symptoms. I know they're really common. So I actually don't know yet if I have gestational diabetes. To be determined. So I did have gestational diabetes the first time around, and I can blame the placenta for that. As soon as I delivered the baby, my glucoses were fine. In fact, they were always really able to be diet controlled, and I never needed insulin, so I was very lucky. But because I had it in my first pregnancy, we screened a little earlier this pregnancy. So around 16 weeks, I did do the glucola drink. It was terrible. I hated it, but I did okay with it. I passed the first round. So we will find out at the onset of the third trimester when they screen again, and we'll see. I don't know. So we'll find out. Oh my gosh, this question. So I have definitely experienced sciatic pain in this pregnancy, and I did not experience it with my first. And I started experiencing it very early almost. Actually, towards the end of my first trimester, I think I started experiencing sciatic pain. So first of all, it's very normal. It's not pleasant, but it's very normal to feel some aches and pains, musculoskeletal aches and pains during your pregnancy as your body sort of shifts. Your center of gravity shifts, your ligaments are more relaxed, and of course your body makes room for a growing baby. However, sciatic pain is very different. It's a condition due to nerve compression. It can sometimes feel like a sharp cramp or even like an electric jolt because it's nerve pain. That sort of, it can stay basically where the nerve exits, so from your low back into your buttock area, or it can sort of radiate down your leg where the nerve bundle starts to traverse and progress. So there's many reasons why you can have sciatic pain. You can absolutely have sciatica outside of pregnancy, but it is very common to see it within pregnancy as well. There's a lot of reasons why. Your OBGYN can review this with you, but a lot of it is, again, compression from the growing baby, shifting, weight as your ligaments start to relax a little bit more. It can definitely happen outside of pregnancy for a number of reasons. Some of the most common are herniated discs, but in pregnancy you can see it from, generalized body swelling, the weight of the baby on the pelvis, loose ligaments, that all kind of cause compression of that sciatic nerve. I actually had a bout of sciatic pain last night, so this feels like so fresh in my mind, but it felt like sort of a hard cramp. It can sometimes have a little bit of like a duller quality to it. Sometimes it can feel like, again, an electric jolt. You can have some tenderness in your low back, like what we call the lumbar spine area where the nerve exits. You can have like a feeling even of pins and needles sometimes, and sometimes even weakness in the foot, depending on sort of how low you feel that sciatic pain, that nerve pain progress. And there's a few different things you can do. You can work with a PT. So during pregnancy, your center of gravity changes. So a PT can sort of help with body alignment, posture, teaching you strengthening exercises that can help. You can also do things like heat. So I told you heating pads are like one of my best friends right now. Massage can sometimes help in that area. Sometimes it might even make it feel worse. So just kind of, talk to your doctor and then find out what feels best for you. Some women find relief from things like even acupuncture. So there's a few different things you can do for sciatic pain, but it is one of the uncomfortable parts of pregnancy that can sometimes occur. So I did have a few questions on being pregnant in the pandemic, and I have to say I have a whole video dedicated to just that, covering all your questions, talking about being pregnant, what symptoms I had when I had COVID-19, and how I made the decision to get the vaccine. So I'm going to link that right here. Definitely recommend you guys check it out. But I got the Moderna vaccine. Of course, I was a little nervous, but my husband and I talked about it and said that, we can only control what we can. And there's, many families who have gone on to expand and have children during this pandemic. And this is something we wanted, and we can only hope for the best. And again, you can only control what you can. So I can control myself masking, distancing, trying to take care of my health, wearing PPE when I see patients, and then just only hoping and praying for the best. In terms of getting the vaccine in the first trimester or not. So I am not an OBGYN, so I can't counsel pregnant women really in regards to that decision. I know there's some OBGYNs who feel more comfortable telling women to wait until after the first trimester. I think that's just a decision you really have to talk to your doctor about. And really the only thing to think about is, if you had the first dose and then you had to wait a good 12 to 13 weeks until you have the second dose. That goes typically beyond the recommended CDC interval. But in general, if that's your doctor's recommendations, then, you would just get it as soon as your doctor okays it. But that's, again, an informed decision that you have to make with your physician. So I do plan to breastfeed. I did have a very difficult breastfeeding journey with my daughter the first time around. I was not a lactation consultant. I was a pediatrician, and I did understand the physiology of breastfeeding, but there was a lot left to learn, and I think I could have changed a lot of things in the beginning. I was an exclusive pumper for many months, and it was really difficult for me. And I hope to not have to do that experience again. I hope to go in with some different frame of thoughts and different actions initially, and hope to have a successful breastfeeding journey the second time around. Every woman's journey is a little different. It can vary woman to woman, pregnancy to pregnancy, baby to baby, and so we'll see. I'm going to try to keep it low pressure on myself and see what happens. As a lactation consultant, I feel armed with a little bit more knowledge, so I feel comfort in starting this second breastfeeding journey. If you guys are interested, I'd be happy to do a video on my top tips for a successful breastfeeding journey, and just drop it below in the comments if that's something that you'd like to see. All right, so rounding it up, let's go back to my craft, pediatrics. So there's actually quite a few visits in the first year of life. We typically see baby in the hospital when they're born, and that could be either a newborn hospitalist who sees them or your outpatient pediatrician. But typically they are seen in the hospital as well. Then you see baby about 3 to 5 days after they're discharged from the hospital. Then at usually 2 weeks of age, unless there's an issue going on that maybe baby's not gaining weight, and then we might pull you back in a little earlier and want you back in the office just so we can check baby out. We then see baby at 1 month, 2 months. Sometimes insurance doesn't cover a 3-month visit, so some practices don't do 3-month visits, but I do 3-month visits as well. 4 months, 6 months, 9 months, and then typically at 12 months of age. So there's a lot of visits in the first year of life. And then, usually we do a 15-month visit, an 18-month visit, a 24-month visit, and then you would kind of space it apart to every 6 months thereafter. So we do see you very frequently when baby is new, and we check on a lot of things in the beginning in the first year of life. You do have some very frequent visits initially. Thereafter, usually after 3 years of age, we see your child every year or so for their annual physical or annual well child check, unless of course there's something going on, or you have a child with complex care needs, or you want to have a physical for another reason, maybe before a surgery or something, then we'd be happy to see your child again for another physical for that. Guys, that about rounds it up. We went through a ton of questions. I hope this was as fun for you as it was for me. If you have any questions below, feel free to drop them in the comments. Let me know if you do want to see a video on my top tips for a successful breastfeeding journey. I'd be happy to make that for you in the future. I actually have a few other ideas in mind, trying to pull on my lactation consultant hat that I think will be really helpful as well. Have a good one. See you guys next week.